is that time of the week where we answer some of your common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks so much for coming in.
You're welcome.
Hey, I don't think I've heard of this, but you say it's fairly common. A lot of our viewers we know probably have nursemaid's elbow. What causes it?
You know, the formal name is radial head subluxation. So
oh yeah, we
basically
can't
what
say
that
that.
is, yeah, it's a fancy term, but it's most commonly known as nursemaids. And what it is, it's the bone in the elbow, really on the thumb side. And the reason why it occurs is because the radial head, which attaches right at the area of the elbow, has a little ligament around it. And before the age of 6, that's underdeveloped, and so it can slip out and cause a lot of pain in the child. And what happens is they stop moving their arm because it hurts so much to move. And the types of injury, or the way it occurs, is a pulling mechanism. So typically it doesn't take much force at all. Many times it could be simple as just stopping them from falling by lifting them up on the arm, or lifting them up to carry them, or even something as simple as pulling their arm through their sleeve. A little bit of force slides it out from under them. So it can be very simple, very common. Now, the good news is that the treatment's very easy as well. It's a simple reduction where you just kind of flex the arm and manipulate the bone. But I don't recommend that you do it at home. It's something that we need to take a look at in the emergency department.
Your child to the doctor.
Yeah, just to make sure that there's no fracture or any other serious injury. Okay?
Teething. What's the best way to reduce a child's pain? I mean, you feel so horrible. They're almost helpless.
I know, and they kind of are. I mean, it's something that's obviously very common. It occurs usually between 4 and 7 months or so, and they can't tell you that it's hurting them. So the things you want to look for is drooling. They may refuse to eat. They're a little fussy, and they may want to bite on things. And the reason why they want to do that is because it actually helps. So the treatment for it is actually that. You want to use cool things. So sometimes freezing a washcloth, maybe some frozen pureed fruits, things like that, just kind of helps soothe, just like ice does on a sprain in adults. That's a very helpful thing. If that doesn't work, you can try something like pressure. Give him a teething ring. Just biting on that gives the gum some relief. Topical anesthetic works, and if all else fails, a little ibuprofen or some Tylenol, and it'll make you through the next few months.
There you go. Babies seeking relief wherever they can. If you have a question for the doctor, you can send it in by going to our website. There it is, WPTV.com. Click on the health link. What you'll do, you'll scroll down. On the right-hand side, you're going to see a form. You can write your question there. Thanks so much for coming in, doctor. We'll see you back here next week. We'll see you in just a couple minutes.